Hey friends, today I am going to read the ulna bone. The ulna is the medial bone of the forearm and is homologous with the fibula of the lower limb. It has an upper end with the two processes, a shaft and a narrow rounded lower end. Side determination. The upper end is hook-like with its concavity directed forwards. The lateral border of the shaft is sharp and crest-like. Pointed styloid process lies posteromedial to the rounded head of the ulna at its lower end. Features. Upper end. The upper end presents the olecranon and coronoid process and the trochlea and radial notches. The olecranon process projects upward from the shaft. It has superior, anterior, posterior, medial and lateral surfaces. The anterior surface is articular. It forms the upper part of the trochlear notch. The posterior surface forms a triangular subcutaneous area which is separated from the skin by a bursa. Inferiorly, it is continuous with the posterior border of the shaft of the ulna. Its upper part forms the point of the elbow. The medial surface is continuous inferiorly with the medial surface of the shaft. The lateral surface is smooth, continues as posterior surface of the shaft. The superior surface in its posterior part shows a roughened area. The coronoid, Greek-like crow's beak process, projects forward from the shaft just below the olecranon process and has four surfaces, namely superior, anterior, medial and lateral. The superior surface forms the lower part of the trochlear notch. The anterior surface is triangular and rough. Its lower corner forms the ulnar tuberosity. The upper part of the lateral surface is marked by the radial notch for the head of the radius. The annular ligament is attached to the anterior and posterior margins of the notch. The lower part of the lateral surface forms a depressed area to accommodate the radial tuberosity. It is limited behind by a ridge called the supinator crest. Medial surface is continuous with the medial surface of the shaft. The trochlear notch forms an articular surface that articulates with the trochlea of the humerus to form the elbow joint. Radial notch articulates with the head of the radius to form the superior radio-ulnar joint. Thus, now shaft. The shaft has three borders and three surfaces. Borders. The interosseous or lateral border is the sharpest in its middle two-thirds. Inferiorly, it can be traced to be lateral side of the head. Superiorly, it is continuous with the supinator crest. The anterior border is thick and rounded. It begins above on the medial side of the ulnar tuberosity, passes backward in its lower one-third and terminates at the middle side of the styloid process. The posterior border is subcutaneous. It begins above at the apex of the triangular subcutaneous area at the back of the olecranon process and terminates at the base of the styloid process. Surfaces. The anterior surface lies between the anterior and interosseous borders. A nutrient foramen is seen on the upper part of this surface. It is directed upwards. The nutrient artery is derived from the anterior interosseous artery. The medial surface lies between the anterior and posterior borders. The posterior surface lies between the posterior and interosseous borders. It is subdivided into three areas by two lines. An oblique line divides it into upper and lower parts. The lower part is further divided by a vertical line into a medial and a lateral area. Lower end. The lower end is made up of head and the styloid process. The head articulates with the ulnar notch of the radius to form the inferior radio-ulnar joint. It is separated from the wrist joint by the articular disc. Ulnar artery and nerves lie on the anterior aspect of the head of the ulna. The styloid process projects downward from posteromedial side of the lower end of the ulna. Posteriorly between the head and the styloid process, there is a groove for the tendon of the extension carpi ulnaris. Attachments. The triceps brachii is inserted into the rough posterior part of the superior surface of the olecranon process. The anterior part of the surface is covered by a bursa. The brachialis is inserted into the anterior surface of the coronoid process, including the ulnar tuberosity. The supinator arises from the supinator crest and forms the triangular area in front of the crest. The ulnar head of the flexor digitorum superficialis arises from a tubercle at the upper end of the medial margin of the coronoid process. The ulnar head of the pronator teres arises from the medial margin of the coronoid process. The flexor digitorum profundus deep arises from the upper 3/4 of the anterior and medial surfaces of the shaft, the medial surface of the coronoid and olecranon process, the posterior border of the shaft through an aponeurosis, which also gives origin to the flexor carpi ulnaris and the extensor carpi ulnaris. The pronator quadratus takes origin from the oblique ridge on the lower part of the anterior surface. The flexor carpi ulnaris ulnar head arises from the medial surface of the olecranon process and from the posterior border. The extension carpi ulnaris arises from the posterior border. The anconeus is inserted into the lateral aspect of the olecranon process and the upper 1/4 of the posterior surface of the shaft. The lateral part of the posterior surface gives origin above downwards to the abductor pollicis longus, the extensor pollicis longus, and the extensor indicis. The interosseous membrane is attached to the interosseous border. The oblique cord is attached to the ulnar tuberosity. The capsular ligament of the elbow joint is attached to the margins of the trochlear notch, that is to the coronoid and olecranon process. The annular ligament of the superior radio-ulnar joint is attached to the two margins of the radial notch of the ulna. The ulnar collateral ligament of the wrist is attached to the styloid process. The articular disc of the inferior radio-ulnar joint is attached by its apex to a small rough area just lateral to the styloid process. Ossification. The shaft and most of the upper end of the ulna ossify from a primary center which appears during the 8th week of the development. The superior part of the olecranon process ossifies from a secondary center which appears during the 10th year. It forms a scale-like epiphysis which joins the rest of the bone by 16th year. The lower end ossifies from a secondary center which appears during the 5th year and joins with the shaft by 18th year. This is the growing end of the bone. Clinical anatomy. The ulna is the stabilizing bone of the forearm with its trochlear notch gripping the lower end of the humerus. On this foundation, the radius can pronate and supinate for efficient working of the upper limb. The shaft of the ulna may fracture either alone or along with that of the radius. Cross union between the radius and ulna must be prevented to preserve pronation and supination of the hand. Dislocation of the elbow is produced by a fall on the outstretched hand with the elbow slightly flexed. The olecranon process shifts posteriorly and the elbow is fixed in a slight flexion. Normally, in an extended elbow, the tip of the olecranon process lies in an horizontal line with the two epicondyles of the humerus, and in the flexed elbow, the three bony points form an equilateral triangle. These relations are disturbed in dislocation of the elbow. Fracture of the olecranon process is common and is caused by fall on the point of the elbow. Fracture of the coronoid process is uncommon and usually accompanies dislocation of the elbow. Medullus deformity is dorsal subluxation displacement of the lower end of the ulna due to retarded growth of the lower end of the radius.